Welcome all. My name is Matt, and I am glad to be joined with Umar Waris and Dr. Jorge Garcia for another episode of the Ideals of Medicine interview series. Both Umar and myself are medical students in the class of 2020, and we will be starting our intern year of residency in the next couple months. I will be completing residency in family medicine at Natividad Medical Center in Salinas, California. Umar and I co-founded this organization, Ideals of Medicine, to reclaim the true narrative of our profession. When we take the physician's oath, we promise to serve our patients first and foremost, not other interests, with the understanding that there are certain ideals that we must strive to live by as medical professionals. Unfortunately, our medical institutions and health policies do not always reflect these ideals. But thankfully, there are medical leaders who exemplify and fight for these ideals, and we welcome the opportunity to learn from them. And we are lucky enough to have an exemplar of these ideals here with us today. Umar, would you go ahead and introduce Dr. Jorge Garcia?
Thank you so much, Matt. Yes, hello everybody. Once again, my name is Umar Waris, one of the co-founders of the Ideals of Medicine, and I will be entering family medicine residency this coming fall at the Mercy Medical Center here in Redding, California. And it is a true honor of mine to introduce a mentor, a role model of mine, somebody who has taught me so much, and I look up to Dr. Jorge Garcia. For those of us that know him here at UC Davis School of Medicine, Dr. Garcia needs no introduction. He is among the most recognized figures at our institution for his teaching, mentorship, and leadership. Dr. Garcia is a proud Californian. He was born and raised in Pasadena, received his undergrad degree at UC Riverside in biochemistry, his medical degree at UC San Francisco, and completed his residency training in primary care internal medicine at Highland General Hospital here in Oakland, California, where he also served an additional year as medical chief resident. He joined the faculty of the Department of Internal Medicine at UC Davis in 1997, where he currently is the health sciences clinical professor of internal medicine. He is also the faculty director for the Office of Student and Resident Diversity here at UC Davis, and also the assistant director of Prep Medico, which is a pre-med pipeline initiative sponsored by UC Davis and the Permanente Medical Group, dedicated to building the next generation of physicians committed to health equity and Latino health. Dr. Garcia is well known and beloved by his students and patients alike, and has been a tremendous source of support, guidance, and mentorship for myself and many, many others. Thank you so much for joining us here today, Dr. Garcia.
Well, Umar and Matt, thank you so much. It's a true honor and a privilege for me to be here today.
Thank you. The pleasure and honor is all ours. And Dr. Garcia, I thought we would begin with a quick icebreaker. During this time of quarantine during this time of COVID-19, many of us have had a lot of time for personal introspection, reading. Has there been a book that you have read recently that has inspired you and you might recommend to our viewers?
Well, you're going to put me on the spot right away, aren't you? The reader in our family is my wife, and so she's always working on 5 books. To be honest with you, I do most of my reading when I'm on vacation. So in a couple of weeks, I'm going to take a good vacation, and my hope is to finally read the First Lady, Michelle Obama's memoir, Becoming, because I just love that title, and I have such a deep respect for Mrs. Obama, and I just love that notion of becoming. And I think as we have this conversation today, I think we'll be able to really highlight some of what I've learned in the process of becoming who I am today.
Fascinating, fascinating. I've heard that book mentioned so many times by so many people, and apparently they've got a new Netflix documentary based on that book that was just released, I think, 1 or 2 days ago. So I think it will be a great companion to that reading as well. And on the topic of becoming, that leads perfectly to our next question, Dr. Garcia, as you were mentioning, that what drew you to a career in medicine, particularly academic medicine? And if you wouldn't mind, perhaps also sharing some of the challenges and inspirations to overcome those challenges that you've had throughout your journey.
Good, Umar. So I was drawn to medicine, I would say, by an awareness of how I could best utilize my God-given talents. And it's interesting. I specifically remember in the 8th grade, my parents sent me to Catholic school. And so my 8th grade teacher was Sister Miriam Donald. And one day, quite unexpectedly, she said to me, you know, Jorge, you're so good at math and science, and you're a class president. Everyone feels great to be around you. I think you should think about being a physician someday, because that's a way that you could best harness the talents that you have. So it's fascinating that she's the first person outside of my family to kind of speak that reality into existence and to really sort of encourage that. She was the first person who told me about the MCAT. I didn't know what the medical college admissions test was, and she told me it was one of the hardest exams that there was out there. But she then said, you know, I'm sure you could take that test and pass it and be an excellent physician. Wow. It's really an incredible thing when I think back to on the day I graduated from medical school, which I will never forget that day. And I know your day is going to be a little different from years past, but I hope it's as special as mine was. And I'll tell you, on that day in the audience, unbeknownst to me, was my 8th grade teacher.
Wow.
And so for me, it was an example of just what the power of a teacher and what teachers can do for us. And it really was, I think, something that kind of really helped me get into medical school. But I'll tell you, I entered medical school with no real appreciation for the people who are responsible for rearing the next generation of physicians, right? My goal was to sort of get in, get my degree, go out into the community and serve people like my mom. That was my plan. But on the very first day of medical school, as I was being welcomed into UCSF, a professor got up to speak and he just blew me away. I remember sitting there in that chair, in that auditorium and saying, who is this person? And how is it that he can say these things that just inspire me and get me so excited about it? Like, wait a minute, and he gets to be a doctor too? Like, there's people who do that? That's their job? And in that moment, I knew like that had to be the best job that there could be. And it was then and there that I knew that I wanted to be a professor like that great professor. So that was what drew me to academics. But a funny thing happened on the way to becoming a professor. Medical school was hard, right? As hard as they told me it would be, and then some. And so I had to really find a way to kind of persevere through all the challenges that it threw at me, through all the times when I felt that crazy dream of becoming a professor would never become a reality. And I was fortunate that I had people around me who continued to encourage me and inspire me. And, yeah.
Wow. I think some of your comments fit so perfectly on something we were going to share with you later on, but I think it's appropriate right now, and that is Happy Teachers Appreciation Day. To you, Dr. Garcia, for being such an inspiring figure to many of us, and it's great to hear that you've had such figures in your life as well. And that brings a question to my mind, was that, do you feel that had you not have had such a figure in 8th grade, that Catholic school teacher of yours, would you have chosen a career in medicine, or would you have even known about or thought about a career in medicine?
It's fascinating, right? I think some of us kind of think that we become who we were meant to be, right? I think as I look back, I kind of do have the sense that this is who I was made to be. This is why I was given the gifts, the talents that I have, right? Others take a more Machiavellian approach, right? You kind of make your own destiny, but I don't know. I sort of, as a spiritual person, feel that she was put in my life for a reason, that she helped me see something that I needed to see at that time. And just the power of teachers. Again, I love, as you know, Umar, I love words so much. And I remember the moment in medical school when one of my professors taught me the meaning of the word doctor. He asked me one day, what does the word doctor mean? And I had no idea. He says, well, what's the etymology? Where does it come from? I don't know. He says, well, it comes from the Latin verb docere, D-O-C-E-R-E. You know what that means? Nope. Have you heard of the word doctrine? Yeah, I've heard that. And what is doctrine? Well, it's kind of like a teaching, right? So docere actually, Jorge, he said to me, is the verb to teach. So doctor, therefore, is teacher. And he said to me in a really beautiful way, so do you want to be Dr. Garcia someday? I said, yeah, that's why I'm here. More than anything else, I want to be Dr. Garcia. He says, okay, so what that means then is that you have to teach your patients first and foremost, right? And if you're lucky enough to have medical students and residents, you have to teach them as well. Otherwise, guess what? You don't deserve the title.
Wow.
That for me was a profound moment. It said like, wow, I have to really earn that title, right? Because I'm going to walk in an exam room, a clinic room, no one's going to know me from anybody, maybe they're meeting me for the first time. I have kind of this crazy hair that's only gotten crazier as time's gone by. Mm-hmm. And so I'm hoping that I can give my patients a glimpse of the doctor they would want to have, someone who's going to listen, someone who's going to care, someone who's going to teach. And it's remarkable how no matter what I look like, that all fades away, and that I can become Dr. Garcia if I do my job right.
Wow, beautiful. Yeah, Dr. Garcia, I think it's amazing how you can break down the basic meaning of words and apply that to what we're really trying to do here. So with that, I wanted to move on to the next question. And we saw on your website that you've a discussion on the relationship between the physician and the patient, right? Which you were just mentioning. And can you describe your philosophy in caring for patients and what goes into building a therapeutic alliance with patients and their families? And are there any guiding principles or ideals that you find coming up in your practice again and again?
Yeah, well, thank you, Matt. I do love words. I also love quotes. And I remember one quote by Dr. Francis Well Peabody, who once said that the secret of caring for the patient is to care about the patient. Mm-hmm. And so I think that that's the philosophy of care that I try to have, is that if I really care about this person, then I have to take a very sincere interest, right? And if I say I really want to serve this patient, that I have to know then that I'm there to serve. I'm not there to self-serve, right? To impose my will on my patients, which, by the way, I can very easily do, right? As you know, in medicine, we have this great privilege of because so many of us have done our jobs well, we've earned society's trust. And so again, we cannot abuse that privilege. And so for me, it's always about how can I then listen carefully to find out what my patient most values, what's most important to them, and so that I can then help guide them into a place where their health is optimized. I often tell my patients that in our journey together as patient and doctor, I would want them to drive the bus. So what that means to me is I want them to be firmly in control of where they want to go in their lives. My job is to be then a guide, right? I want them to have their hands on the steering wheel And I might suggest to them, well, let's take a right at the next corner. And they may say, nope, I'm good. So I want to give them all the information that they need to kind of hopefully steer clear of problems. We may certainly encounter them on the road together, but hopefully then we can work together to steer clear. And, you know, if we find ourselves in a rut, we'll get out of that rut together. But I like that notion of that we're working in a partnership to get to where we're going. But again, it's not about where I want to go. It's about where the patient and their family wants to go. And I want to honor that. So.
Wow, Dr. Garcia, this bus metaphor, I'm very impressed by that metaphor. And I was just curious if you would be able to give an example of either, you know, helping someone else, advising someone else as they're driving the bus, or perhaps having yourself give someone else the opportunity to advise you in your bus driving, so to speak. If you would be able to just to help cement this idea for our viewers.
I really developed this way of looking at things when I had the privilege of working with patients at the end of life. And I remember as an internist feeling overwhelmed at first that I would not be able to do that job well, but that was an important part of who we needed to be as internists. And what I found was I felt personally kind of out of control. And I had to realize that paled in comparison to what patients were feeling at that moment, when they often were facing very, very serious questions, like an incurable cancer, right? So as they felt like that they had no control, I felt it important to kind of give them whatever control they could have back. And that when I was able to do that, that there could be healing, that they felt that, okay, if these are the cards that life is handing me, if this is the hand that I've been dealt, how can I still play that hand well? How can I do the best that I can with that? And it's been my privilege to sort of help patients and families during those moments. And I remember how surprised I felt when family members would say to me, like, thank you, Dr. Garcia, you made such a difference. We can't, right? So entering it feeling so woefully inadequate, and yet somehow, you know, finding that, wow, for reasons I can't explain, I seem to do this well. So maybe I was meant to do this. But I do share that with patients. I do share that, you know, my goal is that you're driving the bus more than ever right now. And it's helped me often with patients where maybe their family members have a different view. And I can then tell the family member, I know you feel that this might be right or the best for your mom or dad, but let's think about where they're at now and what's most important. And so that often helps to resolve even like some of that family conflict. And so I've been able to help some families and patients as they go through that, where maybe the family wants a very aggressive type of approach when the patient is feeling more like, you know, I'm done. I don't want anything more aggressive. I've been able to kind of help resolve that by focusing most appropriately on what's best for the patient.
Tremendous, Dr. Garcia. Wow. I'm just seeing so many of these themes of doctor as a teacher, a doctor as somebody who helps the patient in steering his bus, so to speak, borrowing from the bus metaphor, and not dictating, and using our trust and seeing our trust that we have as a responsibility and not to be misused. I think those are such powerful themes that you've touched upon, such powerful ideals you have touched upon. I think that go into caring for our patients. Thank you for sharing that. And I think why so many students such as myself also enjoy learning from you as well, Dr. Garcia, which brings us to our next question, your role as a mentor to so many medical students and pre-med students, and you work also as faculty mentor of the Office of Student and Resident Diversity at UC Davis. Dr. Garcia, why is mentorship so important to you? And just as it was in the case of the Catholic teacher in 8th grade for yourself, how do you inspire and unlock the potential of students you mentor who are thinking about a career in medicine or healthcare?
Umar, thanks for that question. I'll tell you that I had plenty of people who loved me and supported me, right? Including that amazing teacher and my parents and family and friends. But what I didn't have when it really came time to start applying to medical school was a health professional in the family or a health professional who would help guide me through that process. I remember not knowing how to write a personal statement and seemingly have nowhere to turn, literally dropping to my knees and praying for help because I had nowhere else to turn. And I remember, I probably shouldn't say this, but I struck a deal with the Almighty. I just said, I promise if you help me, I'm going to help others do this. And I think he took that deal because I've had plenty of opportunity to make good on that, and it's been a great privilege. But for me, what I realized was I knew that I needed someone to advise me and to guide me, but that person was never there. So it's funny, my wife once told me that, Jorge, you became the mentor you were always looking for. And as usual, she's right. I think because I went without this, I really wanted to become for people, right, who I most needed, right? And that's been kind of a special part of my journey is kind of, I can't go back and undo that hurt that I felt when I was without a mentor, but I can now affect the present and the future by making sure that my mentees don't have to go through that.
Powerful, Dr. Garcia. I think there's a quote that's coming to mind, and that is that any person who thinks he or she gets to where they are at, thinking that they got there alone, is either without mind or without heart. Because we all have had people that have guided us, and we all need such mentors and teachers for ourselves. And Dr. Garcia, this is also bringing to mind one of the things you have spoken about going back to last year's graduation, the commencement address that you gave for the class of 2019 here at UC Davis. And you had mentioned that we all encounter unexpected angels in our lives who uplift us at moments that we least expected. And you had this beautiful phrase that we are all connected in this rich tapestry of our social fabric. And Dr. Garcia, I guess with that in mind, that if you could perhaps elaborate more on that concept of the rich tapestry that we are all connected by, and how do we best ensure that we remain connected, if that makes sense?
Yeah. So in that talk, I talked about the wonderful life I've enjoyed in medicine, and how that almost didn't come to pass. And so as I was thinking about, well, what I tell the graduates, I remembered one of my favorite movies, which is Frank Capra's It's a Wonderful Life, right? It's sort of an American classic. And so if you remember that movie, there's the character George Bailey who almost ends it all because he doesn't realize what he has and how beautiful his life really is. And so I think back to the days when I was struggling in medical school, literally feeling like I was the ugliest duckling that UCSF had ever reared, and thinking that I could make no meaningful contributions. And I really came very close to just to dropping out of school. So my life as a physician could have come to a premature and I think tragic end had I jumped off that bridge and left medicine. But fortunately, there were some really beautiful people that reminded me at very key moments, right? Don't jump, don't leave, because you are making a difference, right? And so I look back that, wow, it's kind of like, how could I have done this without Sister Miriam Donald, my 8th grade teacher? How could I have stayed in medicine without those key angels who showed up just at the right time to remind me what a wonderful life I had? It's so scary to think if I had quit in medical school or in residency, I would not have lived as a professor of medicine, and I would have missed out on so much. I mean, so much. So I'm grateful for that. But that experience definitely taught me that we as a people are so richly woven together. And it is, to me, a beautiful tapestry, just the intricacies of how we come together and create this living work of art. Now in the midst of this COVID-19 pandemic, I think we're learning some of the same lessons, right? I think crisis sometimes, again, highlights to us what's most important. And certainly we're, as people say, in this together, right? Even though there's times when we're not as together as we need to be. That's right. Certainly true too. But at least it's, to me, something that we can aspire to.
It's an excellent reminder that we're not alone. Yeah.
That's what I love about medicine. I never have to practice medicine alone.
Right.
I'll tell you, if I had to practice medicine alone, without learners, without colleagues who are smarter than me, I'd be terrified. So thank goodness I don't. I'm part of a great team, and teamwork makes the dream work.
Yes. Quoted for truth. Yes. So Dr. Garcia, with that, I think this is an excellent opportunity to continue this discussion with our next question, which is regarding the ongoing epidemic of burnout in medicine. And I was just wondering if you'd be willing to discuss that, and maybe also the conditions of the workplace in medicine and how we go about solving disputes. Maybe, scheduling is always difficult, scheduling time off, dividing those clinical responsibilities or academic duties. How have you been able to navigate those challenges while maintaining meaning and joy in medicine over the course of your career?
That's a great question, Matt. So training back in the days of cave people, no one talked about wellness or burnout. We just accepted the long, grueling days and hours just as a reality. This is what you do for medical training. This is what you do for medical practice. And so we were just kind of stuck on this hamster wheel of, right, that's what you need to do. But that experience taught me two very important lessons. One is that people are gloriously imperfect, and imperfect people create imperfect systems, right? And that we may work in those horribly dysfunctional systems, but we mustn't let them change us. I think we actually have the responsibility to change them into better systems. So when I was training in residency at the county hospital in Oakland at Highland, which was an intense, beautiful training. I remember people would say to me, Dr. Garcia, you're always smiling. You're always in such a good mood. How has this place not driven you crazy? And my response to that was, well, I know this place is crazy, but I'm not, right? I'm not. And so I think that that's kind of always what I keep in mind is like, as wonderful as UC Davis is, it's not perfect, right? So I do my best to sort of figure out how could we be better, right? And I think part of why I'm still here is I see that we're all kind of doing that, right? So it brings to mind some of the best advice I ever got from a mentor who asked me, do you want to be a winner? And I said, well, yeah. And he said, well, join a winning team, right? And so I often say that, right? UC Davis is a great winning team. Again, not perfect, but so we're going to lose some, but we're going to win a lot more. And so I think that's what it's about is we certainly have made great strides with wellness and burnout, but we still have a ways to go, don't we? Mm-hmm. And fortunately, we have some great people from the class of 2020 who are going to continue to usher in wonderful change. So I thank you in advance for that.
Incredible, incredible. So Dr. Garcia, I mean, you mentioned how you were able to maintain your own sanity through your training and beyond.
Just barely.
Just barely, but but enough to get through it. And I was just wondering, you've commented already a little bit, but could you just elaborate more about what is your spiritual practice and how has that played a role in your work?
Yeah, so I've learned about the importance of practicing gratitude, right? So every day, literally counting my blessings and how helpful that is. I ran into one of our wonderful students this morning, and the student just made my day, of course. And I was sharing with the student how discombobulated I feel. That's a good word, right? Discombobulated. Because my routine has been completely thrown off, right? And in spite of that, what I've learned is like, wow, I'm still married to the most incredible person I can think of. We have these wonderful children, right? Two that actually came from our bodies, but then so many more, right, who are our spiritual children that we get to interact with on a regular basis and watch grow into these amazing physicians and nurses and healthcare leaders. So isn't that wonderful? And our son started college this year, and because of the pandemic, he was sent home early. And so we've had all this extra time with him, right? Him going away was like, whoa, I never saw that coming so fast. And I felt like I hadn't finished with him yet. There's still so much more I want to teach him. And so the fact that he could come home like, wow, how blessed are we that we get to spend all this extra time with him and see him. He's a musician. And so we get to see him practicing his art. It's like having a live band in my house all day. So there's just a lot of blessings when I start to think about it, right?
Yeah, you gotta count the live music.
Oh gosh, yeah, right. And the great food we have, and that we live in a comfortable home, that I sleep in a bed every night. Years ago, one of our students shared that it wasn't until the student got to medical school that they first slept in a bed. That blew my mind.
Wow.
Right? Because I had to say, like, wow, there's not been a night that I haven't had a bed to sleep in. How is it that this incredible young person spent so much of this person's life not sleeping in a bed, right?
That's humbling.
That was humbling. Yeah. I've learned humility. If medicine doesn't humble you, something's wrong.
Mm-hmm. And Dr. Garcia, just on this topic of gratitude and meaning and fulfillment that we're talking about, we're currently facing an unprecedented pandemic in recent history. And we are seeing the upheavals it is causing to not just our healthcare system, but also economy and social fabric as well. And we're seeing great heroic acts of physicians and healthcare professionals all around the country. And Dr. Garcia, what would be your advice on during such times of crisis, how we can still continue to find that fulfillment?
Yeah, that's a great question. So I love that we have seasons in life, right? And if I were to ask you, what's your favorite season, right? You would tell me, I would say, well, I like this, but I also like this. And so, winter tends to be a hard season for many people, right? I know as I've gotten older, boy, my bones ache so much more in the cold. I'm not as active as I'd like to be, right? It's a hard season, particularly when it starts raining on top of that. So it's rainy and cold. But what keeps me going is the knowledge, like, this is going to last forever, right? That spring will come again. So we say that hope springs eternal, don't we? Mm-hmm. Right? And I know that the best is yet to come. And so that's what keeps me going is knowing no matter what we may be facing, we're going to face that together, because as Matt said, we're not alone ever. And so as great problem solvers, and I think in healthcare, we are all very gifted problem solvers. We're smart. We're going to put our heads together, our smart heads together. We're going to figure this out, and we're going to emerge in a very good place. Right? I really do believe that. So that's what keeps me going.
Thank you. That was much needed. That was much needed. Thank you for that advice, that insight, Dr. Garcia. Dr. Garcia, if I may tie this to your leadership role once again. Tie this back to your leadership role as the Director of Student and Resident Diversity at UC Davis. You have been a leader in education around serving underserved communities and diversity in medicine. And Dr. Garcia, if you could elaborate, why is diversity so important in medicine, and what are currently some of the barriers that you feel that need to be overcome and that you have overcome in achieving that ideal? Would be happy to learn from your experience.
Thanks again for that question. So I said a little while ago that, physicians in particular, but all healthcare providers have to be great problem solvers. So when we think about that, when it comes to problem solving, diversity is really something that really increases our ability to be the best problem solvers possible, right? Because it really helps us appreciate issues from a multitude of perspectives, right? So I remember learning about a chair analogy. So if there's a chair before me, I don't see the entire chair, I just see part of it. So I don't know what's behind it. I don't know what's underneath it. I may not know on what is on the side that's facing away from me. But if I am surrounded by people who have different perspectives of that chair, I can better understand that chair, right? And so if I'm able to work with those people and learn from what they're seeing, I'm going to be able to really say, gosh, I got this chair down. And I think as we face problems on a daily basis, it's just great if we have those perspectives that I'm probably going to be blinded to. So I like to create situations where in our team, we're all encouraged to contribute, right? Even though I'm the attending, it doesn't mean that I know everything, right? You both know that I don't, right? But working together and including people like the patient and our other health professional colleagues. Wow, now we're really getting to the creative problem solving. So that's really what I love about the work. And I don't like just saying diversity, but inclusion as well, right? Verne Myers, who's a great leader, gives this wonderful definition. She says, diversity is like being invited to the dance, but inclusion is being asked to dance. And I remember when I heard that, it took me back to my middle school days when I went to a dance and I was mostly a wallflower. You know, I was physically in the dance hall, but nobody asked me to dance. And in my heart, I really, really wanted to dance. I wanted to show people that I had moves and that I could contribute. So that's what we want to do, is bring in people from all of these beautiful backgrounds, but allow them the opportunity to shine, to give us and to develop their bests. And we would all benefit from that. But I think where we're at now is that we're very good at talking the diversity talk, but we're still not able to effectively walk the talk, right? And that's what's going to make the difference. I think that's the next challenge.
Powerful, powerful. Dr. Garcia, your analogies, your metaphors, your quotes are weaving beautiful tapestry just in this conversation. We thank you for that. And just going back to that dance metaphor, and that it's not just inviting to the dance, but also being a part of the dance. And how, and not just talking the talk, but also walking the walk alongside of it. And what do you feel is the best practices we can implement to take that next step, to go beyond simply invitation, but also now dancing, so to speak?
I think we have to get very intentional, right? We can't just bemoan the fact that we're not diverse or inclusive, right? If we really want to make a difference, then we have to say, okay, as leaders, as program directors, as deans, right? How do we address this issue? What's it going to take, right? And so, again, I think we're smart enough to kind of figure that out, right? So I often like to teach my patients and learners by asking very pointed, well-placed questions, right? So we might take an issue like health disparities. Now, we know about health disparities. We've studied them for years. We've documented them for years. And isn't it interesting how they're so persistent? So why do we have health disparities? Well, it's a complicated question, but the simple answer is we have them because we allow them to exist. So until we take the steps, right, to really understand the structural inequalities we've created and what it's going to take to dismantle those, right, we're going to continue to have health disparities. Similarly, if we have a lack of diversity and inclusion, well, we're responsible for that. We've created that. Oh, but it's not our fault. It's just, well, we can lay blame where it is, but as long as we have the opportunity, I think we have the obligation to try to get it right.
Dr. Garcia, thank you so much for this discussion. And your points are making me remember the sort of ongoing movement to include a structural competency curriculum into medical education that we see popping up across the country right now in certain medical schools. I was just wondering if you could elaborate a little bit more about your thoughts on whether or not that's a good initiative, and or whether or not the topic of cultural humility comes into play with that as well.
Yeah, cultural humility, the answer is that always comes into play. I'm not the expert in that field, so don't get me into trouble, gentlemen, right? If you want to learn about cultural humility, I have an expert for you. I happen to know one or two. but I think that does come into play, right? When we think about the fact that, we're not the most important people, right? So as we walk into the room, right, society may ascribe that to us, right? But if we don't take the perspective that, you know, I'm here to serve, I'm not here to be lauded or to be praised, right? I'm here to help. That's a perspective that takes humility, right? That we really understand that if we want to make things better, right, it's going to take a lot. I think a lot of the frustration we feel as physicians is that our patients face real world issues that go beyond what we can prescribe or dispense. I remember having a conversation with one of my patients who was homeless, impoverished, hungry, and asking, well, how can I help? And the patient said, you know, you can't really help unless you want to open up your checkbook and write me a check right now, right? Mm-hmm. I don't think there's a lot you can do. And I remember as a young physician saying, wow, you know, I think at the end of the day, he's right, right? I mean, I can try to muster whatever resources I want, but right, there's so much more we have to work on. And again, I think it can be overwhelming if we think that we're the only ones who are responsible for figuring that out, right? I think we have to organize better, and we have to problem solve better. And I always feel that if we're committed to it, there's just nothing we can't do. Double negative, sorry.
That was incredible.
No, Dr. Garcia, this is also bringing to mind when we're talking about structures and how this pandemic is revealing and magnifying so many of the structural deficiencies. And it is magnifying and perhaps even exacerbating some of the disparities caused by inadequate structures of society. And your comment about the homeless patient and his comment that what I need is beyond the realm of a pill or a prescription pad. It's having to do with social conditions. And hence, as you were saying, us needing to organize to perhaps and work together, and not just ourselves alone, but together as teams to around addressing some of these social conditions. Dr. Garcia, I was just wondering if it was possible that you could elaborate a little bit more, if you had any thoughts. I know this is probably a whole conversation on its own, of what that organization, what that advocacy can look like. And I think this would actually then tie in very well with Matt's next question as well.
Yeah, I think it's important for us to always do our best to understand the truth and try to speak the truth, right? I learned that lesson years ago as a very mediocre student with low self-esteem. I found that when I could do my very best to understand a situation and to help a patient or our team even appreciate an important truth that I felt was being neglected, that there was power in that, right? You know, few of us will listen to real truth and try to refute it, right? I know we're living in an era where falsehoods seem to abound by the day, right? But those of us who search for the truth know what's true and what's not, right? You can only fool so many of us for so long. So I think where we can with advocacy is to try again to recognize these truths, to speak them, right? to the right people, right? We certainly, as physicians, have a platform that we're lucky that people do listen to us. But I think often we don't use our voices as effectively as we need to. And I think that needs to change. Part of what I've loved so much about my 24 plus years here at UC Davis is I see the leadership of our students, and where sometimes those of us in faculty positions, we get lazy or complacent or too busy with other matters, right? It's the young coming in who are not afraid to use their voice, who are ready to use their voice, who are making the change, right? We wouldn't have the student clinics we have now without that type of leadership, right? So again, when I'm having those tough days, it's reminders of that we can do so much good, and we've got to continue to do it. I know it's hard, but we can do it.
It's a great reminder that when we're faced with these persistent health disparities, like you discussed, that keep on, the inequality continues, that, when you're faced with that, we can't be afraid to speak truth to power. It's worth overcoming that fear and building those connections. That's a great reminder, Dr. Garcia.
Sí se puede.
Sí se puede. Yes, indeed. So with that, I wanted to bring our next and possibly last question for this interview. With increasing evolution of our technology and the rise of a business ethic in medicine, for example, through the consolidation, theme of consolidation within healthcare sectors and with a for-profit emphasis, how do you feel the practice of medicine and its ideals have changed over the course of your career? And has the system lived up to our highest ideals?
Yeah, it's such a great question. So as I mentioned earlier, I think it's important that we always remember that it's going to be a constant that we're going to work in an imperfect system created by an imperfect person or group of people, right? That's just a given. So because of that, I think it's also going to be true that we're going to be disappointed and disillusioned at work, right? I always say that's why we call it work, because it is.
Right.
But, I think about when I close the clinic door or I'm in a room alone with the patient, I ask myself, has that changed over the course of my medical career? And I no, it's not. Where the outside forces have tried to encroach on that sacred space, right? I've done my very best to keep that out, right? And I think your project of talking about the ideals in medicine, that's the tension. We're forever going to be pushed to change, to become who we're not. And that's when we have to sort of dig in and say, no, the buck stops here, right? This will not affect, and this work is too important, right? So I would say, as I think about that, some of the external has changed, but I think what matters most hasn't, and that gives me great hope, right? I think just as you soon will be taking your oaths, and that's a remarkable thing, right? To publicly declare, right? That these are the values that you're going to live your life as a physician by. Wow, one of the best times of the year for me is when I'm able to sort of reassert that oath with our new physicians, right? I remind myself, and I am that I have that privilege of reminding myself every year what I should be doing as a physician, who I should be as a physician, right? I think, again, that's what's going to keep us. That's going to be our compass. That's going to be our compass, always pointing to the north that we have to follow.
Thank you, Dr. Garcia. if you just have any further advice for us or comments on how can we reclaim that narrative, then how can we reclaim the narrative as doctors, as leaders in social change, and as Dr. Virchow said, the natural attorneys of the poor. What else could we do to accomplish that goal?
Well, you know, I think the lessons of history are so important, right? And I'll tell you that as Americans, you know, we're not always taught geography very well. We certainly don't know our history as well as we need to. If we did, I don't think we'd be kind of in the pickle that we find ourselves in so often. For instance, physicians are not always the champions of good, right? More often than not, they've been parts of the problem. I remember seeing this wonderful documentary recently that talked about how when one of the most important changes in the American medical institution was being debated, and that's Medicare, the establishment of Medicare. President Johnson was trying to get that passed. And who was opposing him in that effort? It was the American Medical Association. It was physicians who were more concerned about their own self-interest, what they could charge for visits, right? More concerned about that than they were about their patients. Right. And so I think it's just important that we just always remember who we're supposed to be and what we're supposed to be about, right? One of the very first patients I saw in medical school, I saw with the physician, and I was shadowing this physician. He happened to be an internist. And we walked in the patient's room in the hospital. And before we walked in, the physician said to me, "Now, watch out, this is kind of a salty guy." I'm like, "Oh, salty guy, what does that mean?" So we walk in, and almost immediately they started getting into this huge shouting match, back and forth, right? And I remember thinking, what the heck is going on, right? This seems so wrong. It felt so wrong, right? And then finally, you know, the physician said, if that's your attitude, there's nothing going to be able to help you, Fred. He goes, "Well, fine, I'll just find myself a new doctor." "Well, fine, okay. And so, "Come on, let's go." Okay, so we left the room. And I'll tell you, as we did so, I don't think anyone felt good about that. I know the patient didn't. The doctor continued to fume for another few minutes after that. And I felt horrible having witnessed this traumatic event. And it was then that I established my rule, my simple rule. And that is, to the best of my ability, my patients will feel better after my visit. It's a very simple rule, but that's how I know I'm doing a job. If my patient feels better after my visit, then I know I'm doing a good job, because isn't that what doctors are supposed to do? Mm-hmm. We're supposed to help people feel better. Yep. So that's my advice, is just remember the simple beauty of why you became a physician, right? You want to help people, you want to make them feel better. And so just do that.
Right.
And you'll do well. It's served me well these past few years.
Mm-hmm. Mm-hmm. Yeah, that's definitely the goal. Not always so easy, but that's a powerful reminder as well, Dr. Garcia.
So I know you both are going to walk that talk. Yeah, and I so love this. I can't thank you enough for this wonderful, wonderful experience. And thank you for this important work, for letting me be part of it.
No, the pleasure once again has been all ours, Dr. Garcia, and this has been just such a rewarding conversation. And as I've mentioned earlier, you have been a mentor to myself and countless others, and I hope that those viewing will see how and why you have inspired so many. And these gems of wisdom that you have dropped will continue to live not only in my and Matt's heart, but hopefully as many, many more people view it, will continue to live on in the hearts and actions of all who see it afterwards as well. So thank you once again, Dr. Garcia. On behalf of Ideals of Medicine and all those watching, thank you for joining us and all that you do and for being a role model. And in light of Teacher Appreciation Day, thank you for being our teacher as well.
Thank you, Umar and Matt, but we'll see how many thumbs down I get.
Mil gracias, Dr. Garcia.
Igualmente. Muchísimas gracias. Okay. Thank you.
Great.